Well, this afternoon, neglected tropical diseases, often called NTDs, continue to affect millions of people, particularly in low-income and vulnerable communities. Yet they remain among the least talked about public health challenge. From river blindness to elephantiasis, these conditions still pose a significant burden on Ghana. Well, ahead of World NTDs Day, which is happening tomorrow, we're taking a closer look at what NTDs are, why they are even called neglected in the first place, the impact they have, and Ghana's success so far. We'll also be highlighting the challenges that remain in the fight to eliminate them from our country. Joining me now in the studio is Dr. Joseph Opare, he's Programs Manager, Neglected Tropical Diseases, Ghana Health Service, and David Ajiman, his Country Director, Site Savers. They are major donors when it comes to all our efforts in Ghana to look at NTD. So I'd like to start with Dr. Opare. We appreciate your time here on the Pulse. Welcome to the show, gentlemen. Let me start with you. Why do we even call them neglected in the first place?
Okay. So in the first place, we are looking at 21 diverse conditions, diseases that affect the poor, right? And they're also found in remote communities and poor environment. They are called neglected. Why? Because they don't kill. Okay, the diseases do not kill directly. They come in the form of chronic diseases. Formerly, they were called neglected. Why? Because some people found out that funding for these conditions were ignored. Right, but now the history has changed, okay? Then also, when it comes to funding per se, this is where we have issues with getting funding to manage these conditions, worldwide. Then also, when it comes to the community level, these people affected are found in remote communities, and of course, these cases affect the poor as well. So because of that, they hardly come out to be seen and to be treated. Yeah.
And let's look at our situation here in Ghana.
Okay.
What are our numbers and what area are we even neglected in the first place?
All right. So I'll talk about endemicity of these conditions. So as of now, we have onchocerciasis as one of the neglected tropical diseases endemic in 149 districts, right? We have lymphatic filariasis being transmitted in 2 districts. We have schistosomiasis also found in every district in Ghana. You have leprosy. We do record about 270 cases of leprosy each year. Borrelia ulcer, we have them in about 350 districts in Ghana. So we talk about endemicity of these cases in the districts which we live in. Right.
And let's look at the regional breakdown. Okay. Do you have data suggesting which regions are most affected and how best we can tailor solutions for those regions?
Okay, so as I did mention, let me start with trachoma. Some years ago, we had the upper regions. We have the 5 northern regions affected, okay? But since 2018, trachoma has been a thing of the past. We've been able to deal away with trachoma. So when it comes to, as I said, lymphatic filariasis, we have 2 districts, okay, that are at risk with the infection, right? Then, as I mentioned, that every year, okay, 270 leprosy cases are recorded, almost 270 leprosy cases. Then we have schistosomiasis in almost every district, and soil-transmitted ailments also in the same vein. Yeah, so we have these conditions dotted everywhere, okay? But when it's about trachoma, we saw most of these cases in the northern part. When it's about lymphatic filariasis, getting elephantiasis and also hydroceles, most of them are found in the 2 upper regions. But these cases are also found down south as well. Okay, but when we talk about concentration, that is it.
And then how do I even prevent some of these diseases? I'm just thinking, looking at the regional breakdown, the areas, because most often than not, we do a lot of traveling by virtue of our job. You don't know what to do to be safe wherever you go. So walk us through the procedure and what exactly I can do to prevent some of these.
That's a very, very good question. Let's start with the various diseases, okay? When we talk about lymphatic filariasis, all right, we are talking about taking seriously mass drug administration. We have medicines that we give to the entire population, the population that is endemic, the communities that are endemic, we do what we call mass drug administration, right? Then also, what is the vector here? We are talking about the same mosquito, right? It's a vector. So all that goes into prevention of, let's say, malaria. When it comes to the vector control, we also apply these issues over here, sleeping under the bed nets, a key, using repellents and insecticide spray and all that. So that is for lymphatic filariasis. When it comes to onchocerciasis, we are talking about getting involved in mass drug administration. We have a very good medicine, a donation that we use, we give periodically twice in a year so that infected communities could get cured, right? So you give the medicine, it's taken out of the parasites are taken out of the blood, the circulatory system, and you don't suffer from the complications of onchocerciasis. Then schistosomiasis is about avoiding open defecation and urination, right? So there's hygiene here. We are supposed to make sure that we observe good sanitary practices, right? And also getting rid of the water snails from the stagnant waters, which is a bit difficult. So hygiene is key here. Mass drug administration is another issue. Then making sure that we avoid these kind of snails, which is a bit difficult. Let's talk about leprosy. It's about getting those who have the condition. Contact tracing is key over here. And you know, leprosy is a condition of the skin, okay, and sometimes of the skin. And over here, they present as patchy, reddish, or whitish skin patches, all right? Whitish or reddish skin patches. And when you look at the site, you find out that there's loss of sensation, okay? So with these conditions, what do we do? It's about detecting these cases clinically, all right, doing lab tests as well. Then we make sure that we link up with the contacts so that they could be treated free of charge. In the same vein, when it comes to, let's say, disease like yours, it's also a skin disease. We get it through contact, yours and scabies. So it's about avoiding overcrowding, avoiding usage of common, wearing the same clothes, usage of sponge, the same sponge, towels, and so forth, which sometimes
So the married couples, they should not share the same towel?
It's not the best. They shouldn't.
I see.
Because if one has the infection, it could be transmitted to the other person. So basically, when it comes to prevention of neglected tropical diseases, we are looking at mass drug administration, where we have the endemicity, we do the treatment, right? We observe good sanitary practices here. Then also we make sure that we have potable water, which is key. We avoid overcrowding and so forth. These are basic things that we need to do to make sure that we get rid of NTDs from the country.
And you agree that we need a lot of sensitization, especially in rural communities, to drive home the message. It will hope to tame the numbers, but then you would need money to do that. So let me come to Mr. David Ajiman, who is seated next to you. Thank you for your time here on The Pulse. You've been financing some of government's efforts to actually deal with NTDs. So far, what's the response? Is your money making any impact in Ghana?
Yes, a lot. SciService has been funding the government of Ghana since the 1970s, actually. And in 2018, we were one of the key organizations that supported the government of Ghana to eliminate trachoma. So that is a huge impact. And also, currently, if you take river blindness, for example, we have reduced the transmission. The prevalence has really gone down, and many of the districts that were previously endemic are currently recording zero prevalence. And if you look at lymphatic filariasis, for example, there are 119 districts that were endemic from the beginning, and currently there are just 2 of them remaining that are, remaining endemic. So yes, I think we have been making the impact with the effort of everybody, all stakeholders. We are making impact.
I see. And let me come back to you, Doc. Are we indeed making impact? How are sensitization drives going, especially in our regions?
Okay, so really we are making impact. Okay, Ghana, we have 14 neglected tropical diseases, or I should say 14 neglected tropical diseases have been identified, right? but we have been able to eliminate some of them. When we talk about guinea worm, it has been eradicated since 2018, trachoma since 2018, 2023, we were able to eliminate human African trypanosomiasis. And it's all about the campaigns we've started or the campaigns our predecessors started and so forth. So it's about awareness creation. And this is exactly what we are doing, okay, now, okay, as we have to celebrate the World NTD Day. So awareness creation is happening tomorrow.
I'll come to you to tell me your plans for that celebration,
okay.
But I'll come back to Mr. Ajiman, because there are funding challenges I'm sure you're experiencing. How are you dealing with that internally?
Right, so we've been working with stakeholders. I think this is a very important time for the government to come in to support. This disease, NTDs, have been donor-driven, and the site service has been a key partner for years. But as you rightly said, you know, the global situation is changing as far as funding is concerned. So some of the things we are doing include, sensitizing key stakeholders. I think we need stakeholders in Ghana to support the process at this point. Looking back to some of the diseases like guinea worm, we made the most impact when the government, for example, earmarked funding, for the eradication. And we want to see that now. So we're calling on the government and other stakeholders in Ghana to support site savers in this effort.
And then I'll come to Doc, because do you have the money to support some of these initiatives? Let's look at our financial records, especially because of our projections. I'm sure you have targets for the year 2026. Do you have the money?
Well, as Mr. Ajiman rightly said, our source of funding, the source, we have two sources here. So we have partners supporting, and also we have the government supporting us in diverse ways, right? So most of the activities are going to be sponsored by the partners, and one of them, the bigger one, is Site Savers Now. We also have Hope Rises, we have World Vision, we have Water Aid, Growth Aid, and NISWAD, and other partners. Of course, we are also expecting more from the side of the government, but so far, a lot has been committed into it. Our salaries are being paid, we have places of work, and when it comes to the field work, there's also commitment, but just that we need more. So that is it.
Need more, like Oliver, you're always asking for more. But then you must have targets for the year 2026, especially as we're going to be celebrating World NTD Day tomorrow. What are your targets, and how do you plan to even achieve them?
All right, so we are saying that we are going by the WHO targets, And the first one says that by the year 2030, at least 100 countries should have been able to eliminate one neglected tropical diseases. So in our case, we have about 3 now, right?
So you're on course.
We are on course, and we hope that by that time, lymphatic filariasis, we are looking at maybe a year or 2, should be a thing of the past. Schistosomiasis, we had a target of controlling the disease, but now we are looking at elimination. So we are looking at 2030 as well. Leprosy, borrelial ulcer, we are looking at the control aspect. Leprosy elimination, borrelial ulcer, the control aspect. And we have all the plans to make sure that we are able to achieve our target by 2030, right? So that is it.
And we're looking forward to that. What are your activities for the day? I know that you have something planned. Tell me about it.
So in the first place, you are invited, to do what? To come and help us create awareness about the impact of neglected tropical diseases in our communities, and the fact that these conditions could be eliminated, right? So come and help us do that, right? All hands on deck. So first, there's going to be a float, at Medina, and we are all going to showcase neglected tropical diseases, messages of prevention and awareness creation. So there's going to be a float by health workers and school pupils. Then there's going to be a grand derby, right, which we expect our leadership to be there. Of course, they'll be there, right, and all the stakeholders. Then there's going to be media engagement. So what we are doing now, we are going to continue that tomorrow, and for some time.
And the media engagement is very important for me because
Exactly.
I have a key concern. How do you plan to bridge the funding gap now that, you know, US aid has withdrawn some of their funding for Ghana? We also hear that Trump and the US have withdrawn from the World Health Organization. So that's also chipping away at some of their financial gains. I'm sure that is impacting us as a country. How are you bridging that gap?
The first kind of effort is like what we are doing. We are selling neglected tropical disease and we are looking for buyers, all right? So we hope, and we've made our concerns, we've aired our concerns already. He said that the most important thing here is that with neglected tropical disease, they could be prevented, right? And could be treated, all right? So that is it. So all that goes into the prevention, all that goes into the treatment, we are telling everybody to come and support. Thank you.
Thank you so much, Doc, and thank you, Mr. David Ajman, for your time here on The Pulse. We appreciate your time and company. Well.